An kada chako tuoni na donje yath mar ARVs to nok aneno ka ne an gi pogruok. Kadhi puodho ok anyal pur. Atiyo kode dwe achiel.
I used it for 1 month.
Koro anyalo tiyo puodho gimoro seche auchiel.
I started feeling different. I could start working and even for 6 hours.
Koro achako chiemo maber ma gimoro amora mitna.
And appetizer came into my life and I began eating very well.
I've used PC1 for 5 weeks. Before I started using PC1, I used to get tired all the time, but nowadays I feel I'm strong. I can do my work.
I'm a widow and I've lived positively for 15 years of age now. So at the moment, I'm now able to go to my business. At least I get some small income so that I can support my son.
Since I've been taking it, at least I've been strong. I can do my work. I've not been very weak like I used to be.
Mimi nasikia nguvu kidogo. Nasikia nguvu sana. Stronger.
Pogruok masana no kan strong.
And she's got a lot of change. She can now work. She's very strong. She can even work on a shamba with no problem.
Kenda winjo ka denda oken kaka nyocha yot cha winjo ka denda duo.
I can work a long time. Before I was not managing. But now I can manage to work a long time.
Yadhni osebedo kadhi kodwa maber kabisa. Kech mokuongo ne kana dhi puodho kago kwer diriyo kama tawinjo mana ka dendo osejoy. Lakini kana chako booster ne adhi 1 week. Tanena mana ka ngufu noduogo dichiel matinde kendo kora nyalo sana nyalo dhi puodho ma minote mabigola puodho ni aora mudu gi ywenye duogo.
Yes, I'm very strong. Right now I'm digging my fish pond.
A year ago, would you have been strong enough to dig a fish pond?
No, I would not.
And I can now do my works very easily. I can move from here and there, which I did not do initially. I'm very thankful for the booster and it has helped me a lot.
Sana winjo kategno.
Now I'm feeling strong.
Before I started using the booster, I was really down. I couldn't walk properly. I was weak. But after, when I started using the booster, now I can walk. I'm strong. I can go to work. I do everything. So I thank God for your life. You have brought us the booster. It's helping us.
Koro kanyo taneno kumora ni mana ne okang'eyo ni oketo dhok mamit ahinya. Dhoga mit sana.
The thing which has changed is the appetite first, because I had lost appetite. The appetite was very low. I couldn't eat. I was just eating a little bit. But now I can have appetite, especially lunch hour. I can eat a lot.
Since I take PC1, I've really changed. At first, I lost my weight. It was almost 40, but now I'm 54. I'm weighing 54 kgs.
But I'm only surprised that I can eat so much. That's some appetizer.
I did not have an appetite, but right now the appetite has gone up. I added 3 kgs since I started using it.
To booster nyaka ncha chak madha winjo ka toka mita dwaro kata mana achiemo sate.
Eating was a problem for me, but now I can eat any kind of food. I can eat, no problem.
And she was very, very thin. And since she started to take that medicine, she's looking better, and she's walking. At first, she's failing to walk.
But people are saying I'm looking beautiful now. Before I was not taking this medicine, I used to get 49 downward. but now I'm 68. The doctor said, what are you taking? You have grown fat and you are looking beautiful.
I was low, I was not eating, and this supplement now I'm eating a lot. I'm eating and strong doing my work. I gained weight, I was 45, now I'm 55.
Ndaona kusiyana kwa nthazi zangu pokali ndingusika ndingaba 59 so ndi 68 kgs.
Starting taking this drug, I was weighing 62 kgs. But as for now, I went to the state hospital weighing 72 kgs.
My weight is increasing. The time I started the PC1, I was taking 41 kg, but now I'm reaching to 48.
Hapa 61 si uje ni scale. Kwani so na ndi to 69. Abangaruta kwani so na para ngukira pa scale na wakashita kufumba ai mwari ya makola. Ndito 69 nditika kafuma ndangata pa 29 ya.
Roughly 5 kg.
5 kg in the last month.
50 to 60.
Oh.
Maybe always 49. Now I'm 61.
What I noted when I started using PC1, first and foremost, I was not having a lot of appetite. I started eating very well. My weight which of course I was having formerly, it was 47. But now at least I'm ranging to 60.
Give me bananas.
Yes.
Yeah, I can eat anything.
At first, when I started taking medicine, when I went to the hospital, my CD4 was at 9. 208, it was at 9.
Yeah.
Yeah, and 2011, it was just coming at 58. But since I started taking this medicine, it has gone up to 430.
After 2 weeks, I was now able to stand up. And then the third week, I went for another test. I found that my immunity had rose from 100 and the CD4 had increased to 600. They were wondering because he's on his last phase. There's no any other drug that is going to be changed for. It's either to die or to stay there. His CD4 was stagnant at 450. When I went to test, that was last month, 26th of September, the CD4 had rose to 820. And they were wondering, how comes now? How comes this stagnant CD4 has now shoot up immediately to 800? So it's a case study in the health facility.
When I was using these ARVs, I was okay. But my CD4 count was going down. It was not coming up. But immediately, I started using PC1. In fact, the first month I went to the clinic, the CD4 count rose by 100. Normally it was not growing. It was coming between 3 and 450, between 3 and 450 there. Yeah, it was not going up. My CD4 last time was 20, I went to the clinic lastly on 24th September. It was 940.
My CD4 count by the time I was starting the supplement, it was 100. When I went back after 3 months, just believe it was 400.
Koro togi CD4 mara kane pok achamo booster to CD4 na ne an gi 481. Koro chakre nyocha cham booster kanyocha dhie CD4 to ayudo ka an gi 740. Koro aneno ka booster no konya.
Before I started using the booster, my
Yes.
CD4 count was 38. But now it has raised to 200 and above.
My CD4 was 250, but when starting this booster, my CD4 is now 470.
Kende kinde no ne CD4 mara ne 400 gi wiye
Te kinde ni koro chako chorore ma en 788 laro 800 sa. Ta asetiyo gi booster kuom ndalo matin.
So after a while, I went for a checkup. I found myself that Nini was boosted somehow from 494. Then I was having 786.
Before I started to use PC1, my CD4 was around only 2. But now I'm 385.
So in June you repeated the CD4?
Yes.
649. And your CD4 count was 214 a year ago.
Yes.
My CD4 was 280, but now I'm 770. That, of course, is a tremendous change.
And by the time I was giving out the medicine, her CD4 was 212. After 1 month, when she went back for a test, the CD4 was 689.
I started when my CD4 was 143, and now it is 625. The remedies is doing for me well, and I'm improving very well.
CD4 mara 350. Askana umia booster.
When I first began using the PC1 booster,
Kana chaka duge test CD4 mara no yudo 1005. Akanyuko yudo tuo yote ni atu rakata via bara.
since that time I've not been feeling any problems within my body.
I want to say that the immune boosters worked on me well. I was not in good terms with my husband in terms of sex, because after realizing that I'm gaining weight and I'm having strength, I said no to open sex, and it should be condom use or abstinence at that age. At a certain time we even collided over that, but with the time he agreed and we're using condom.
I also live with orphans, and then I work so hard to help them and to have them eat well. Before I started using this remedy, I was hopeless in my life, and to my biggest surprise, even the clothes were not fitting me. I was thin. And you know, now I am feeling fit, and I've started using my old clothes which I put aside because they were not fitting me. Thank you. We are very grateful.
I had a lot of symptoms, e.g. vomiting, coughing, pains in the body, chest pains, and I was always be admitted at the hospital. The time I started to take PC1, these symptoms, other symptoms have gone.
I'm okay, and PC1 I can say it's wonderful.
Even though you are sick, but your life can continue.
That medicine, so good.
My sexually intercourse also was not active. I was getting problems with my husband always. Whenever he asked for sex intercourse, I could not admit because I used to be weak. But now I'm very healthy. Though we do it with the condom, yani we precautions. But I'm active, he's happy, and my family has become very happy.
See, my condition was worsening, but now you cannot believe it. You cannot believe it.
Nowadays I can play netball, I can play volleyball. I'm a good player.
I'm happy. I'm happy.
We also administered PC1 at the orphanage, and you have seen that the children have they have improved on the appetite, so that they have helped the children to at least to eat, to make them stronger, so that they can be coming to school and they can join their friends.
Before he was hospitalized for diarrhea, and he has no appetite of taking food. and Dr. Harry van der Zee gave her PC1, and since from that time the boy is just fine and he's...
Watu wanashangaa.
People are really wondering what is happening.
Tunapea watu tuni wanaamia nyithinda ngo.
What are you giving the children that have really brought this change?
Koro PC1 ewokonya.
Yeah, she's saying that kudo for PC1, it has really helped her.
I've working with HIV programs for a long time. Let me just give you an example. I have a patient. Because of ARVs, he was even unable to walk. He was, when he wanted to pass some urine, he was being carried after prescription of PC1. This person now is just okay. He can get up by herself, cooking, do everything by herself.
Na aya nakwenda kunyamula huko ndiko na makora. Marundi alikuwa ya kuzazira, pano sio kuzizira. Na sio kuwawa. Pano njale kunuma pafupi.
And the pain in his legs? No more pain.
My legs used to have numbs, like now. Yes, and I used to have a very bad headache, but now I'm okay.
Before I started using PC1, my legs were very weak. I was using a stick while walking, but afterwards, now I can walk very strongly.
And I have more appetite of eating. Even my leg, I have stopped pain nowadays, and I work hard so much. Yeah. I was walking like this.
She's failing to walk at first.
But nowadays, I cannot see.
Before I had a great pain, especially my feet. There was pain, paralyzed, and it was worse. But now I feel better off.
I had problems with my legs when walking, but now at least I can walk. I can put on high heel as you have seen me today. At the time I could only put on flat shoes.
But for Chinheche Hospital, as I've said, that over 60, 70 people who are on HIV, who are taking this PC1, they are really doing better.
The response has been very good. Everybody is saying she or he is improving since she started the remedy. For the PC M1, PC1, we have about 260 patients who are registered here.
Have you seen patients, HIV/AIDS patients, that have not responded to the remedy?
For this remedy, I think at least everybody is saying he's seeing some improvements in her body.
The doctors are monitoring the opportunistic infections. They're actually improving, and improving tremendously.
The experience I have with PC1, it works.
They are doing very well, and even doctors are amazed. What is this thing?
Me, as a clinician who has seen the benefit of PC1, I usually initiate them on PC1.
Nous confirme avoir eu une bonne évolution après la prise de nos médicaments et ses résonances.
And this PC1 has got no side effects. Anybody can take.
En tout cas, ma conclusion avec ce médicament est que c'est un médicament très efficace, puisque nous avons vu que même avec une seule dose de 5 gouttes, on a fait presque un miracle.
ARVs have their side effects and all these things. So the longer we can put somebody out of ARVs, for me, the better. And with the partnership and collaboration, if the Kenyan population could get PC1 program, we are going to have healthy lives.
I enjoy working with people with the HIV because I know HIV is not a disease that can kill unless you yourself want to die out of HIV/AIDS.
We thank you very much.
Yeah, I'm so happy.
I'm so happy because you good people came here. You help us.
Wanilage, wanilage,